Thanks for staying with us here on The Pulse. Now, a report by the Statistical Service says 27% of children scheduled for a vaccination since March 16 missed it due to COVID-19 related reasons. The report noted nearly half of households with at least one child below 5 years was due for a scheduled vaccination. Now, reasons assigned include fear of getting infected with COVID-19 at the various health facilities, and in some cases, vaccines were simply not available. We'll delve more into this shortly, but first, my colleague Justice Bedu traveled to the Afram Plains and brought us this report.
Moses Ganke is one of the country's frontline health workers, going at it alone in one of the places where many of his mates would rarely go.
Talking about the challenges, in fact, if I want to start, I can say I may not even finish.
This is the island community of Helen Haji. It has no electricity, no potable water, and no mobile telephony network. The only clinic here was built by the villagers themselves. Moses recalls how the lack of refrigerator for medicines affects the work that he does.
Just last month, I did 5 deliveries. During delivery, you have some emergencies or complications, and those drugs that you can use to ameliorate those situations are supposed to also to be kept under cold chain or in the refrigerator as well. But where is the fridge? The deliveries, you have to do it because you don't have enemies. By the time you say you are referring them, they might either deliver on the bank or on the lake.
He has to travel on the sometimes turbulent Afram River using a boat, a journey that sometimes could take up to 2 hours to the nearest community that has electricity every day to store medicines like vaccines.
The facility we are not having engine boats, so I have to rely on people who are having. They don't even have commercial boats that apply to where I store the vaccines. So I have to be begging them, making arrangements. So by the time they are done, it's almost getting to see something. I am appealing to the authorities, the government, Ministry of Health, Ghana Health Service, and benevolent individual or Ghanaians. This one I'm not just appealing, I'm begging. In fact, I don't know if I should be on my knee, but maybe it will disturb your recordings. Otherwise, I will be on my knee for them to come to our aid to save these innocent children.
Moses' story is like that of many health workers in remote communities across the country. He is hoping that something changes about that soon. Justice Bedu, JoyNews, Helen Haji in the Afram Plains.
Now, international NGO with focus on child development World Vision has been carrying out similar studies, and we've been joined on Zoom by their health technical program manager, who is also a public health specialist, Irabna Kweiba Dazi. Thank you very much, Madam Dazi, for your time here on The Pulse. First of all, let me take your reaction to the Statistical Service report that 27% of children scheduled for vaccination since March 16 missed it. Are you surprised?
No. Good afternoon to your cherished listeners. And I want them to keep their dial on JoyNews because we really give them the best in news and the best in everything they have to know.
Thank you very much.
I am not surprised at all because COVID-19, it's coming with a lot of repercussions in our health system, and we really have to see into the future and act fast on it. Per our studies that we have conducted and our visits in the rural communities that we work in and in the remote communities, we have had the same thing. There have been several times we have gone to the health facility and it has been closed down. After some investigations, we noticed that the health workers don't have enough PPEs to work with. Some of them have gotten infected, so the other staff that are part of the contact tracing are under quarantine awaiting results. So I'm not surprised at all with this data that is coming from the Ghana Statistical Service, and I'm happy that we have this results in time, and it will give us a lot of opportunity to start working hard to address the repercussions before it gets too late.
What are the consequences of missing such deadlines for children and the effect on infant mortality, for instance?
Yes, considering the effect on infant mortality, it's really high because already Ghana, we have a high infant mortality rate. We were not able to meet our Millennium Development Goals that just ended, and now we are working with Sustainable Development Goals indicators that as a country we are supposed to meet. Per World Health Organization standards, we are also lacking behind in our indicators for neonatal in cases for reducing neonatal mortality and reducing infant mortality. Currently, we have 57 per 1,000 live births that are lost yearly, and also out of every 24 children, we have one dying before reaching the age of 1. So the impact on children healthcare in the health system is really high, and we have to look at it and work very hard, provide all the necessary resources that are needed. Now, I would want us to look at the health workforce and also the health financing. We would notice that COVID-19 pandemic has come with a lot of impact in these areas. The health workforce that were working with us in all the other pandemics that we have, like malaria, HIV, malnutrition, cholera, diarrhea, and everything, they are the same health workers we are using for the COVID-19 pandemic. In this case, we see that our health workforce would be under a lot of pressure, and we might not get them to deal with issues efficiently, effectively, as they are supposed to do, because we already had a lot of shortage in the doctor to patient ratio and in the nurse to patient ratio. As a country, our doctor to patient ratio is 1:8,600, and our patient to nurse ratio is 1:565 per the Ghana Health Service report 2016. And it hasn't changed that much from then till now. And as it stands now, some of these health workers are also getting infected with COVID-19. And as a result, most of the CHIPS compounds in the rural communities are being closed down because they don't have adequate PPEs to work with, and they don't also want to risk their lives. Now, coming to immunizations, we used to leverage very much as a country on outreach centers, which has stopped because of the impact of COVID-19. Some of these outreaches that are being conducted in some districts are no more ongoing. We would have to look at that system, equip the health workers enough with the PPEs, let them go back to the communities and conduct the immunizations. Otherwise, we might have increase in the number of children that are supposed to have the immunization, and we would go back into the fact that we are having a lot of children who are not immunized. If these children are not immunized, we know the repercussions. There are some children that are going to die from measles. We are going to have polio outbreak, as we already also have some incidents of polio in the country.
Yeah. And that's very interesting, because I was coming to the other areas of health as far as children are concerned. We've looked at the immunization, but also malnutrition is also another area which I believe that you have been considering. What have you found in that area as well?
Yes, in malnutrition, we have also found that a lot of children are not having adequate feeding that they are supposed to get. When you look into the Ghana Statistical reports that they just shared, it was very evident that about 56% of families were not able to provide the 3 square meals that they are supposed to provide. Some of them were also reducing the amount of food that they were feeding the children with. Some of these children in the rural communities and the urban slums also leverage very much on the school feeding program to sustain them during their lunch and stuff like that. Now we have our schools closed down, and these children might not have enough food at home. So it would lead to increased malnutrition in this area. Now, when we look at our health financing also, a lot of finances that should have gone into supporting all these malnutrition policies and other things that the Ghana Health Service were running, all these funds are going to support COVID-19. So it means that we are lacking behind the funds that we have to support the already existing health system. Now, malnutrition is not just a standalone. Malnutrition affects children. Malnutrition increases malaria. Malnutrition increases diarrhea. And all these other pandemics are going to be affected as we have issues of malnutrition going up.
Now, I want us to look at practically how we can address this issue. And I want to read some of the reasons given for missing the vaccination. The first one, which I already said, is affecting people being afraid of getting infected with coronavirus. The other is the fact that there are no vaccines available in some instances. And in other instances, you find that some of the centers have been turned into management centers for coronavirus. In those instances particularly, what will be your advice? Because we're still dealing with COVID-19. It has not left us.
Yes. So in that instance, what I would advise is that we should leverage very much on our outreach centers that we used to have. These outreach centers were doing very good if you go to the rural areas and the rural communities, because for some communities, they don't have a CHIPS compound there. They don't have a health facility there. So it's the outreach that was supporting them in the immunization. Okay. So if we can equip health workers with the adequate PPEs to go out to have the outreaches, it will be very important. Again, the government would have to make sure that a lot of financing is going into the immunization, malaria, malnutrition, and all other existing pandemics before COVID-19 came on board, so that we don't have all our attentions on COVID-19 and leave out on the others. Otherwise, it would also be disastrous. So we should also look at financing the immunization units very well, to give them enough funds to procure more immunization, so that the facilities that have run out of this immunization, we can replenish them for them to go on with the immunization. Because as we see in the data now, about 50% of children under 5 have lost their immunization schedules per the Ghana Statistical Service reports that has been shared.
Absolutely. And we're hoping to get the Ghana Health Service to help us understand what they're doing to bridge this gap, because we can't have all these children miss the deadline for the year to just run dry. Definitely, there'll be the need for some rescheduling in order to make time for these children and give them the opportunity to do so. I want to thank you for your time. That's Irabna Dadzi. She is the health manager with World Vision Ghana, and also a public health specialist, joining us with some analysis and education on this research done by the Ghana Statistical Service and also World Vision. Now, away